why use transdermal magnesium instead of the tablets? This is the main question we were asked when we first brought this out, because it's a relatively new concept. If you look at the work of Dr. J. Cohen, he talks about, I think he's probably talking about magnesium oxide, but he talked about when you take the oral magnesium, you can lose up to 94% of the magnesium in your stomach acid, so just goes straight through. Whereas when you use transdermal magnesium, you get about 98-99%, so you're getting the magnesium that you paid for straight into your body. Also, what we found is the blood supply in the body only contains about 0.7% magnesium. So it's often not, when there's been an injury in the body, the calcification occurs around the injury, and the amount of magnesium in the blood is often inadequate to dissolve the calcification or the stiffness around the injury. So putting transdermal magnesium on with a spray or a roll-on gets exactly where it's needed really, really quickly. So in terms of bioavailability, you're getting a much better, much more economic, a much faster acting method when you use magnesium on the skin rather than taking the pills or powders. And a lot of doctors prescribe blood tests for magnesium. This is a complete waste of time, really. The magnesium levels in the blood will remain at 0.7%, and if they change slightly, then the body will draw magnesium from the blood and the marrow, and even from the internal organs, in order to, it's very, very jealous, the body, about keeping that magnesium level exactly at 0.7%, and that's mainly because of the cardiac function. A lot of the mechanisms are aimed at supporting the health of the heart, and especially with magnesium, which is the part that contracts, that releases the contraction of the heart. The magnesium is really important, and so blood tests are an inadequate way of gauging your magnesium levels. There is a test called the RBC, the red blood cell test, which gives you an authentic reading of your magnesium. So hope that helps. If the person who's taking it is very deficient in magnesium, there's going to be a tingling, or it could even be a stinging sensation. You'll be glad to know that this goes away the second or third time it's used, because it brings the magnesium levels up so quickly in the body. And so again, it could be a stinging, or sometimes there's maybe 1 in 100 people might get a rash, but this will go away with continued use, and it goes away very quickly. It is safe for all ages, and there are no particular contraindications with any medicine whatsoever. Basically, it's a lot more effective than taking oral magnesium, and this shows itself in A, how quickly it works, and B, the amount of people that are taking magnesium tablets and saying they've still got the same symptoms. This will make them go away quickly. Thank you.